The Heart Institute at Intermountain Medical Center is a combination of several different subspecialties within cardiology. We have our interventional cardiology group, we have our heart arrhythmia specialty group, which I'm a part of, called Intermountain Heart Rhythm Specialists. We have our cardiac surgery group, and we have our heart failure and transplant specialists. While each of us work independently, we also work together as part of the Institute to provide overall combined integrated heart care for patients who come not just from Salt Lake City, but from the region as a whole. What's unique about the Institute and about some of the procedures that we're doing here is that we can also offer the highest level cutting edge technology in an integrated fashion to help take well-rounded, world-class care of our heart patients. Catheter ablation is a technique used to treat heart rhythm disorders, where we work with long, skinny tubes called catheters that are placed through the blood vessels of the legs and sometimes the side of the neck through a very small hole, no incisions involved. We place these catheters inside the heart and track down the short circuits that lead people to have heart rhythm problems. And then once we've figured out where the short circuits are, we can cauterize that tissue in the heart to help cure or at least control the heart rhythms that the patients are suffering from. The stereotaxis magnetic catheter navigation technology has the benefit of employing a soft tip catheter. What that means is that the catheter itself is not stiff like our traditional catheters, which could potentially poke a hole into the heart. Instead, the catheter is soft and rests against the heart tissue. It has the benefit of also staying in contact with the heart as the heart moves inside the body and as the body itself moves with breathing. The integration is so good with the magnetic system that we can be extremely confident about exactly where our catheter is inside the patient's heart. And what that means is that we can vastly reduce the amount of fluoroscopy or X-ray exposure that both the patient and the physician get. Because of how the catheter is moved using the magnetic field, I can actually move the catheter millimeter by millimeter within the patient. Also, if there's a spot that I thought was interesting, I can actually, with a click of a button, get the catheter back to that same spot again and return to where we think we've needed to work. There's really nothing that is offered anywhere that we cannot offer here.